gastric sleeve operation is relatively new as a standalone operation. It was developed as a first stage in a two-stage operation called a duodenal switch, or a biliopancreatic diversion. This was reserved for very high-risk patients who were very obese. The idea was that they would start with the sleeve operation, which was considered to be low risk, and the patient would lose a considerable amount of weight. The patient would then come back later for a second operation where the intestine would be rearranged for malabsorption and further weight loss. What happened was the patients were found to lose a considerable amount of weight, more than expected, with just the sleeve surgery. In 2007, there was a consensus conference meeting in New York City where a number of surgeons discussed the merits of gastric sleeve operation as a standalone operation. And their findings were that the sleeve itself was very effective in causing weight loss all by itself. The advantage of the sleeve is that it's a simple operation. We're just narrowing the stomach down to a skinny tube from a big baggy stomach. It doesn't require any foreign body to be placed, and it doesn't require a complicated rerouting of the intestine. This gives it certain advantages compared to the other surgeries. With regard to early complications, the gastric sleeve is intermediate between the lap band operation and the gastric bypass. The bleeding rate is definitely less than the gastric bypass, as well as the leak rate. However, the lap band itself is an extremely safe operation on the day of surgery. In fact, there is not another operation that's any safer than a lap band operation in the abdomen. But the real advantage when it comes to complications with the gastric sleeve are in the long-term problems. The gastric sleeve is not vulnerable for ulcers. It's not vulnerable for small bowel obstructions or internal hernias like the gastric bypass is. Therefore, reoperations for these problems are avoided. It has no foreign body. Nothing needs to be adjusted, and nothing can slip or erode as with the lap band. Therefore, one of the major advantages of the sleeve gastrectomy is the avoidance of long-term problems that might require an operation. Although the gastric sleeve is a simpler operation, it also appears to provide the same amount of weight loss as the gastric bypass. This is very predictable and early weight loss. Patients can expect to lose somewhere between 2/3 and 3/4 of their extra body weight in the first year and a half after an operation. The weight loss with the gastric sleeve is much more predictable and early compared to that with the lap band, and it avoids some of the other problems that can happen with the bypass, such as vitamin and mineral deficiencies. When it comes to curing other problems related to weight that comes along with obesity, such as high blood pressure, diabetes, high cholesterol, or sleep apnea, the gastric sleeve operation appears to be almost as good as the gastric bypass. Although the gastric bypass is the best operation at curing diabetes or getting it under control, the gastric sleeve is also very effective. Approximately 60 to 70% of patients who have diabetes prior to surgery will have it resolved completely with a gastric sleeve operation. The remaining patients will either have better control or the disease will be arrested in its current form. Patients after a gastric sleeve operation will be required to take a vitamin for the rest of their lives. However, vitamin and mineral deficiencies are not very common. They can occur in the first year to year and a half due to the significant weight loss that the sleeve produces. However, vitamin deficiencies are more rare and less severe than with a gastric bypass, and they are easy to treat in the long run. Most patients with a vitamin or mineral deficiency after a sleeve operation will have that resolved within the first 2 years. If you have any questions or need any other information, please visit our website or call your surgeon's office.